Have you ever thought that a small bluish vein on your leg could one day cost you your life? It sounds unbelievable, but there are real cases where someone went from feeling a bit of heaviness in their legs one afternoon to being rushed to the ER just months later because a blood clot had travelled to their lungs. They believed it was simply a normal sign of aging, until their doctor said, if you'd come in 24 hours later, there would have been no chance. Varicose veins are not just a cosmetic issue. They are a silent condition, starting with symptoms that seem harmless, then progressing into dangerous, even life-threatening complications. In this video, we'll uncover the little-known truths about varicose veins, why seniors are more likely to develop them, the early warning signs most people ignore, and how to protect your legs so you can keep walking strong and confident through your golden years. Understanding varicose veins. Think of your veins as soft, flexible highways, running throughout your body, carrying blood back to your heart. In your legs, that job is much harder. The blood has to travel upward, working against gravity. To make this possible, your veins are equipped with tiny one-way valves that keep blood from flowing backward. When these valves weaken or become damaged, blood starts to pool, creating increased pressure on the vein walls. Under this pressure, the walls stretch, twist, and become visibly raised beneath the skin. This is when you start noticing those blue road maps on your legs. In the early stages, they may not cause pain, but over time, this blood pooling damages surrounding tissues, leading to inflammation, swelling, and a host of other complications. The important thing to remember is this: varicose veins do not go away on their own. Once the vein valves are damaged, they cannot fully repair themselves. Why seniors are more prone to varicose veins over time. Every structure in the body experiences wear and tear, and your vein system is no exception. After 60-70 years of constant work, the vein walls lose elasticity and the valves become thinner, weaker, and more likely to leak. On top of that, many older adults live with chronic conditions such as high blood pressure, diabetes, high cholesterol, or heart disease. These issues can change blood pressure patterns, cause vein inflammation, or slow circulation, all of which contribute to the development of varicose veins. For women, menopause brings a significant drop in estrogen, which weakens the vein walls and makes them more vulnerable to damage. Add to this the reduced physical activity that often comes with retirement, and circulation slows even further, placing more pressure on the legs and increasing the risk of varicose veins. Early warning signs often overlooked. Varicose veins rarely make a dramatic entrance. They arrive quietly, like an uninvited guest. You may feel your legs grow heavier toward the end of the day, notice slight swelling around your ankles, or experience an uncomfortable tingling or crawling sensation at night. Some people start to see small, red or purple veins on the skin that look like a spider's web, aptly called spider veins. Many dismiss these as just a cosmetic concern, but in reality, they are an early warning sign that your veins are under increased pressure. If you notice these symptoms appearing day after day, don't ignore them. This is your golden window to take action. Intervening now can stop the disease from progressing to more serious and harder to treat stages. Advanced symptoms you shouldn't ignore. As varicose veins progress to more severe stages, the affected veins become large, twisted, and clearly bulging under the skin. You may start to feel a constant dull ache or sharp pain, along with a burning sensation in the area. The skin around these veins may turn brown or purplish, become dry and itchy, and bruise or tear more easily. In advanced cases, swelling in the legs can be so severe that walking or standing for long periods becomes extremely difficult. The most dangerous stage is when stubborn non-healing ulcers develop or when blood clots form inside the veins. A deep vein thrombosis, DVT, can block blood flow, and if a clot travels to the lungs, it can cause a pulmonary embolism, a medical emergency that can be life-threatening. Risks and complications if left untreated. Many people think varicose veins are just a cosmetic concern, but in reality, the consequences can be far more serious. When blood pools in the veins over time, pressure builds up, damaging the surrounding tissues. One of the most common complications is chronic leg ulcers, wounds that are extremely difficult to heal because blood and nutrients can't reach the area effectively. Another serious complication is deep vein thrombosis, DVT, a condition where a blood clot forms inside a vein, causing severe pain and swelling. Even more dangerous, if the clot breaks free and travels to the lungs, it can trigger a pulmonary embolism, a medical emergency that can be fatal within minutes. In addition, people with long-standing varicose veins are more prone to vein bleeding. In such cases, even a minor bump or injury can rupture a vein, leading to bleeding that's difficult to control. These complications not only pose serious health risks, but can also severely reduce your quality of life. Common misconceptions about varicose veins. One reason varicose veins are so common in older adults is the abundance of misconceptions surrounding the condition. These myths cause many people to hesitate, missing the early treatment window, the golden opportunity to prevent serious complications. Myth number 1. Varicose veins are just a cosmetic issue. Many believe that those twisted, bulging blue veins only make the legs look unattractive and have no real impact on health. In reality, they are a sign that blood circulation is compromised. If left untreated, pooled blood can lead to vein inflammation, chronic leg ulcers, or dangerous blood clots. There have been many cases where ignored early symptoms progressed to a pulmonary embolism simply because the warning signs were dismissed. Myth number 2. If it doesn't hurt, it doesn't need treatment. Some patients only see a doctor once the disease has reached an advanced stage, often because they don't feel any pain. But varicose veins usually progress silently. Even if there's no discomfort, damage inside the vein walls continues to spread. It's like a bridge quietly rusting away. You won't notice it collapsing until it's far too late. Myth number 3, only older people get varicose veins. While the risk is higher in seniors, varicose veins can develop at any age, even in young people, especially those who are inactive, overweight, pregnant, or work in jobs that require long hours of standing or sitting. Believing, "I'm too young to have it," often leads younger people to ignore early symptoms, allowing the condition to progress more quickly. Myth number 4. Wearing compression stockings is enough. Compression stockings are just one part of treatment. They can help relieve symptoms and slow progression, but cannot replace lifestyle changes, regular exercise, and a healthy diet. In more advanced cases, medical interventions or surgery may still be necessary. Myth number 5. Surgery is too dangerous, so it's better to avoid it. In reality, many modern treatments are safe, minimally invasive, and offer quick recovery times. Patients can often go home the same day without a long hospital stay. Avoiding surgery out of fear and delaying treatment can make the condition harder to manage later on. Once you understand the truth behind these misconceptions, you'll see that varicose veins are a serious health condition that deserves your attention. The earlier you detect and address it, the better your chances of protecting both your legs and your overall health. If you're watching this video and find this information helpful, don't forget to subscribe so you won't miss out on reliable medical insights, practical advice from experts, and inspiring stories to help you live a healthier, more fulfilling life in your golden years. One small click could make a big difference in your health journey. Specific risk factors for older adults. Varicose veins can develop at any age, but older adults face a higher number of risk factors. Genetics. If your father or mother had varicose veins, your risk increases by 2 to 3 times. Gender. Women, especially after menopause, are more likely to develop the condition due to hormonal changes. Previous occupation. Jobs that require long hours of standing or sitting, such as teaching, factory work, or office work, place extra pressure on the veins. Weight. Being overweight adds stress to the legs, making it harder for blood to flow back to the heart. Lifestyle habits. Low physical activity, smoking, and a diet lacking in antioxidants can all increase the risk. Understanding these factors can help you take proactive steps to prevent varicose veins before they develop or worsen. The link between varicose veins and heart disease. Varicose veins aren't just a problem in your legs, they're an SOS signal that your circulatory system may be in trouble. When veins become enlarged, the amount of blood returning to the heart decreases, forcing the heart to work harder to pump blood throughout the body. This extra strain can worsen existing cardiovascular issues such as heart failure, high blood pressure, or coronary artery disease. According to a US study, people with varicose veins have a 30% higher risk of developing heart disease compared to those without the condition. That's why, if you notice unusual symptoms in your legs, you shouldn't just check your veins. You should also get your heart health evaluated. The role of exercise and light physical activity, movement, is one of the simplest yet most effective medicines for preventing and improving varicose veins. Activities like walking, swimming, and light cycling not only strengthen the calf muscles, but also help pump blood back to the heart more efficiently. Aim for 30 minutes of activity each day. You don't need to push yourself to exhaustion. Consistency matters more than intensity. Even simple at-home exercises, such as heel raises, ankle rotations, or flexing and pointing your toes, can boost circulation, especially if you spend long periods sitting or standing. Nutrition for vein health. Your diet plays a key role in maintaining healthy veins. Vitamin C supports collagen production and strengthens vein walls found in oranges, grapefruit, kiwi, and bell peppers. Vitamin E helps prevent blood clots and improve circulation, found in almonds, sunflower seeds, and olive oil. Flavonoids reduce inflammation and lower venous blood pressure, found in berries, apples, and green tea. Fiber prevents constipation and reduces pressure on veins in the abdomen and legs, found in oats, leafy greens, and lentils. Pairing this diet with adequate daily water intake will help keep your blood flowing smoothly. Daily habits to reduce pressure on your veins. A few small lifestyle adjustments can make a big difference. Change positions regularly. Avoid standing or sitting for long periods. Elevate your legs when resting. This helps blood flow back to the heart more easily. Wear compression stockings. They support circulation and reduce swelling. Avoid tight clothing, especially around the thighs and waist, to prevent restricting blood flow. These habits not only reduce strain on your veins, but also help you feel lighter and more comfortable throughout the day. Modern medicine offers many effective, minimally invasive treatments. Conservative treatment, compression stockings, circulation-supporting medication, and lifestyle changes. Minimally invasive procedures, laser therapy, radiofrequency ablation, or sclerotherapy to close or remove damaged veins. Surgery, reserved for severe cases to remove the affected vein segments. These modern methods allow for quicker recovery times, minimal discomfort, and significant improvements in quality of life. Your legs have carried you through countless journeys, from the vibrant days of youth to the quieter seasons of your golden years. They deserve to be cared for and protected so they can continue to walk beside you in the years to come. Varicose veins are not the end of the road. With the right knowledge, healthy habits, and timely attention, you can keep your legs strong and steady. Start today, because every strong step you take is another day your life feels more complete.